When communicating with an individual living with dementia or cognitive impairment, it's important to approach the situation with patience and understanding. It's also important to remember that the person sees the world differently than we see the world. Here are some key tips for best communication. Approach from the front and at eye level. Always approach the person from the front, ensuring you're at their eye level. This makes the conversation more comfortable and helps them direct their focus on the conversation. A person's eyesight changes and visual field narrows as dementia progresses. Give time to acknowledge your presence. Allow the person time to recognize that you're trying to communicate with them before speaking. Be a good listener. Listen actively and give the person enough time to respond. Remember, their processing time may be slower, so patience is key. A rule of thumb is to wait 30 seconds before repeating yourself. It may feel uncomfortable to wait, but it helps. If the reason they did not respond is because they did not hear you, then most likely they will let you know. Lean in to show you're listening. Slightly lean in to show you're paying attention and use clear adult language. This helps the person feel respected and heard. Pay attention to body language. Nonverbal cues can speak volumes. Be mindful of their body language as it often conveys more than words can. The use of body language goes both ways. If your facial or body language is expressing something other than interest and participating in the conversation, the person living with dementia will catch on. Give space when agitated. If the person becomes agitated or shows signs of aggression, take a step back and give them space. This can help prevent escalation. Speak slowly and clearly. Speak at a normal pace, clearly and without raising your voice. Avoid yelling or whispering, as these can cause confusion or distress. Remember, as dementia progresses, the use of less words is better. Individuals living with dementia comprehend 1 out of 4 words spoken. Reduce distractions. Minimize background noise and distractions to help the person focus on the conversation. Provide one step at a time. Break tasks down into simple, manageable steps. Giving one instruction at a time can prevent overwhelming the person. Be redundant. Calmly restate key points. Repeating information calmly and respectfully can aid in understanding. Don't get upset if you need to restate things. They're not trying to be difficult, their short-term memory is just impaired. Avoid asking, "Do you remember?" Rather than asking if they remember something, offer details or cues such as pictures or act out actions to help them connect with the information. Listen for the emotion behind the words. Often the emotion the person is feeling is more important than the specific words they use. Pay attention to their tone and validate their feelings. Meet them where they are. Avoid arguing. Instead, meet the person in their mindset. Be careful not to correct their feelings or views. An example of this is if they are in a different time period in their life. Meeting them in that reality to engage in a conversation is important. Take a step back when needed. If you start to feel frustrated, it's okay to take a step back, breathe, and regain your composure before continuing. Behavior and reactions is a form of communication. Lastly, it's important to know that all action, behavior, and reactions are a form of communication. The person living with dementia is trying to communicate an unmet need, and it is our job to investigate what that is to help them. By using these tips, you can create a supportive and positive environment that helps those with dementia feel respected, understood, and less stressed. Remember, patience and empathy are key when communicating.